great. All is well with you and the baby. Would you like to come and sit down, please?
We have a question for you. What is preeclampsia?
Preeclampsia is a poorly understood condition that happens only during pregnancy. It usually appears after the 5th month of pregnancy or in the days that follow delivery. Preeclampsia causes high blood pressure and may affect other organs in the mother, such as her kidneys, her liver, or her brain, and sometimes the placenta.
What causes preeclampsia?
It is not known what causes preeclampsia. Most experts believe that it begins very early in pregnancy with a problem in the placenta.
What are the symptoms of preeclampsia?
There may be no symptoms of preeclampsia for many weeks. However, your healthcare provider, and by that I mean your doctor, your nurse, or your midwife, may be able to detect preeclampsia during regular prenatal visits by checking your blood pressure and taking urine samples. Signs of preeclampsia may include hypertension, what we also call high blood pressure, over 140/90. Most of the time, this would not cause you to feel unwell. Too much protein in the urine also does not usually cause you to feel unwell. Headaches that are usually throbbing in quality, like a heartbeat, increasing in intensity, and that do not go away. Vision problems, and we include bright flashes, dark spots, or blurred vision. Abdominal pain, which is located either in the pit of the stomach or the right side, under the ribs, especially if there's nausea and vomiting. Swelling in the legs or fingers is very common in normal pregnancies. Many women notice that they have difficulty removing or putting on their rings. However, it is not normal if the hands or face become very swollen or if your weight rises suddenly, and by this we mean more than 1 pound a day. You should report any of these symptoms to your healthcare provider. Preeclampsia can also begin after delivery, usually in the days after, but sometimes up to 6 weeks after delivery. It is important to see a healthcare provider rapidly if you have any symptoms. If you only have high blood pressure without any other signs, you have a disease that we call gestational hypertension or high blood pressure of pregnancy. This condition is less severe than preeclampsia, but still needs to be followed closely as it can change and become preeclampsia.
Am I at risk of preeclampsia?
Every pregnant woman is at some risk for preeclampsia, although it is only seen in about 1 to 3% of all pregnancies. Gestational hypertension is more frequent and happens in 5 to 6% of all pregnant women. Certain women, however, are more likely to develop these conditions. There are several risk factors, and they include a first pregnancy. 10% of all first pregnancies are complicated by preeclampsia or gestational hypertension. A first pregnancy with a different father. If this is not your first pregnancy, but it is your first pregnancy with a new partner, you may be at an increased risk. A pregnancy that occurs less than 2 years or more than 10 years since the last pregnancy. Having experienced preeclampsia in a previous pregnancy, a family history of preeclampsia in either your sister or mother, women that are older than 40 years old, and obesity or being overweight. Multiple pregnancies, like twins and triplets, also increase the risk. There are several diseases prior to pregnancy which increase the risk, and these include hypertension or high blood pressure, kidney disease, diabetes, previous blood clots, or lupus. And finally, fertility treatments, IVF, also known as in vitro fertilization, or pregnancy resulting from sperm or egg donation.
Can preeclampsia affect my baby?
Most women with preeclampsia will deliver without any complications to their health or to their baby. However, healthcare providers take this condition very seriously because preeclampsia is still one of the leading causes of maternal and fetal illness in pregnancy. During preeclampsia, the placenta does not function perfectly well. The baby is receiving less food, which may result in an underweight baby. Sometimes, sudden early detachment of the placenta may happen, which is dangerous for the well-being of the growing baby. Fetal deaths, though very rare, have occurred in some of these situations. Some mothers with preeclampsia will need to deliver their baby before the usual time, which is 37 weeks. A premature baby is at risk for many health and development problems and may need to stay in the hospital for a long period of time, sometimes weeks to even months.
Can preeclampsia affect my health?
For the mother, The major dangers of preeclampsia include seizures, strokes. She may develop water in the lungs, heart failure, kidney failure, and bleeding problems in the brain or liver. However, most of these problems are rare, temporary, and heal completely after the delivery of the baby. In very rare cases, death has occurred. It is important to understand that many of these complications may be prevented by regular prenatal visits with your healthcare provider.
Can we cure preeclampsia?
The only cure for preeclampsia is the delivery of the baby. The hope is that delivery can wait until the baby is full term, which is 37 weeks. If the diagnosis of preeclampsia is not certain, or if the baby is not yet full term, then your healthcare provider will watch your symptoms carefully until your baby is ready to be born. Sometimes, though, this is not possible because the symptoms are getting worse and your baby's health appears to be in danger. If this is the case, your healthcare provider may recommend the premature delivery of the baby. It is still possible to have a vaginal delivery, and by that I mean a natural delivery. However, in certain situations, a cesarean section might be necessary. Your healthcare provider will discuss your best option with you. One of the biggest problems for a premature baby is that the lungs are not fully developed, and he may not be able to breathe on his own normally. If the baby is at very high risk of very early delivery, your healthcare provider may choose to give you injections of a medication called beta-metazone that will help the baby's lungs develop faster.
If I get preeclampsia, will I need to be hospitalized before the delivery of my baby?
Often women with preeclampsia will be hospitalized because the condition may become suddenly worse and mother and baby need to be watched closely.
Can she stay home?
Sometimes some women with gestational hypertension may be allowed to stay at home, but some rest is often recommended for the remainder of the pregnancy. If your healthcare provider decides that it is safe for you to be at home, you will probably need to have frequent visits with him or her. Blood and urine tests may be done to make sure the condition is not getting worse. And the well-being of your baby may be also checked frequently with heart monitoring, and that's a recording of the heartbeat for a few minutes to a few hours, and also ultrasounds.
Are any medication used to treat preeclampsia?
Occasionally, medications can be given to decrease blood pressure if it is too high. These medications rarely cause any side effects to the mother or to the baby. Sometimes, magnesium sulfate given by IV, a tube in the vein, is recommended to women with severe preeclampsia during labor or after delivery to prevent seizures, one of the rare but possible risks of preeclampsia. It is safe for the baby.
If I get preeclampsia, what can I do to help myself and my baby?
The best way that you can help yourself and protect your baby's health is to carefully follow your healthcare provider's advice about rest, blood and urine tests, and medications. Appointments should never be delayed or missed because preeclampsia can change rapidly.
When will the preeclampsia symptoms go away?
For most women, the symptoms of preeclampsia will usually go away as soon as the baby is delivered, but high blood pressure and abnormal blood and urine tests may continue for up to 3 months. Sometimes, more frequent follow-up visits with your healthcare provider may be needed. If symptoms come back in the days after delivery, you should rapidly report it to your healthcare provider.
Can preeclampsia be prevented or avoided?
The best way to prevent problems related to preeclampsia is to have early and regular prenatal care and to report any of the symptoms outlined here to your healthcare provider as soon as they occur. This is especially true if it is your first pregnancy, if you've had preeclampsia in a previous pregnancy, or have some of the risk factors mentioned before. An adequate calcium intake, and by that I mean 3 to 4 portions of dairy products per day, may reduce the risk of preeclampsia and is recommended for all pregnant women. If your healthcare provider thinks you are at high risk for preeclampsia from the beginning of the pregnancy, low-dose aspirin, 80 milligrams per day, may sometimes be recommended.
Thank you very much for these informations.
You are most welcome. If you have any questions about preeclampsia, speak with your healthcare provider at your next visit.